Well, thank you again for joining us today. Again, both ASL interpretation and closed captioning are available throughout the webinar. We are recording this webinar to again be emailed out to all registrants, and the recording will be posted on our website at able-today.org/questions-and-answers. If you have time upon the conclusion of the webinar, our ABLE experts will be remaining on to help continue to answer ABLE-related questions. And please note, for today's webinar, we will feature numerous categories of ABLE-related questions and ABLE program directors from across the country. Next slide, please. Again, thank you and welcome to a conversation with ABLE Savings Plans. The National Association of State Treasurers hosts the only national working alliance for all ABLE programs, called the ABLE Savings Plans Network, or ASPN, ASPN. ASPN is a working alliance of state ABLE program administrators and industry stakeholders who work together in coordination on industry issues, advocacy, and outreach. Additionally, the NAS Foundation launched ABLE Today, which supports national outreach for ABLE programs, directly engages the disability community, and provides resources on ABLE accounts. Together, ASPN and ABLE Today work to empower people with disabilities toward more independent and secure futures by offering tools like this webinar and resources on the benefits of ABLE accounts. And my name is Eric Achmanik. I work for the National Association of State Treasurers, and I'm the program director for ABLE Today. Next slide, please. This webinar is a direct follow-up to our national webinar for ABLE accounts and Social Security benefits that we hosted in February 2023. Today's webinar will help feature some of the over 700 questions we received during that webinar. We're going to review those questions and hopefully answer as many as possible. We're additionally going to be highlighting background on ABLE topics, including eligibility, enrollment, and contributions. Discuss ABLE account management and ABLE qualified disability expenses, and answer ABLE questions on tax obligations, Medicaid, and much, much more. So please stay with us as we work through the webinar. Again, we're going to try to answer as many questions as possible. Please try to hold off on putting questions into the chat, as I promised we're going to try to get as many as we can throughout the presentation. Next slide, please. Our panelists today come from a wide range of various offices across the country, as well as different ABLE programs. First, I'd like to introduce David Bell, who's the Deputy Director of the Oregon Treasury Savings Network. This is the division of the Oregon State Treasury that oversees the 529 college savings plans, ABLE Savings Plan, state-sponsored auto IRA program, and financial literacy efforts. Brittany Chipley is the Executive Director for Arizona's AZ ABLE program. Prior to her current position, Brittany was the Probate and Mental Health Deputy Court Administrator for the Superior Court of Arizona. She also was the North Regional Manager for the Division of Child Support Services with the Arizona Department of Economic Security. In her spare time, though, she does love trying new restaurants, spending time with her husband and 2 young daughters, watching football, and also overseeing her and her husband's grant-funded youth football and girls basketball teams in South Phoenix. Next slide, please. Stacy Pfeiffer is the Assistant State Treasurer and Director for Nebraska's Enable Savings Plan. Stacy is a mom of 6, and in her free time enjoys gardening, baking, and singing. She's been a director of the Nebraska ABLE program since February of 2002 and loves sharing the good news of ABLE. And last, we have Eric Jimenez, who currently serves as the Chief Policy Director in the Nevada State Treasurer's Office. In this role, Eric oversees a variety of programs that range from infrastructure financing to increasing financial independence for marginalized communities. During the COVID-19 pandemic, Eric administrated the largest small business assistance program in Nevada history and launched a first-in-the-nation program for children with disabilities. Eric has previously represented various gaming, healthcare, education, energy, and transportation clients in front of the Nevada legislature and has worked to enact numerous disability reforms in Nevada over the last decade. On behalf of all of our panelists, again, thank you for joining us. We have a robust and experienced group of able experts today to provide information. And with that, Stacy Pfeiffer from the Nebraska Treasurer's Office is going to hopefully help start us off with a great preview and background on able accounts. After that, though, we're going to have an interactive and engaging conversation with the rest of the panelists, hoping to answer your questions from the last couple of months. So on the next slide, Stacy, thanks again for joining us, and we look forward to your presentation.
Great, thank you, Eric. As Eric said, my name is Stacy Pfeiffer, and I'm the director of the Nebraska ABLE program. Today, myself and others are representing directors of ABLE programs across the country. We want to make sure people know about ABLE accounts and how to utilize them to help achieve their goals. Imagine a tool that allows people with disabilities to save money in their own names and more than just $2,000, being able to accumulate wealth without losing eligibility for benefits, and being able to work without having to spend down their current or future income. Imagine being able to focus on a lifetime financial plan instead of only being able to look at the current month. ABLE accounts make all these things possible. Next slide. So now I'm sure you're asking, what is an ABLE account? Well, ABLE accounts are savings and investment tools built specifically for people with disabilities. They allow individuals to save money without impacting benefits up to $100,000. ABLE accounts are offered under Section 529A of the U.S. Tax Code. And it is important to note that while ABLE accounts do work with benefits, we operate within the Treasury, not within Social Security Administration. Our plans work alongside benefits, not under them. Next slide. Now that you've learned more about what an ABLE account is, you might be wondering if you're eligible for these life-changing accounts. There are a few guidelines for eligibility. These guidelines are the same across all plans. First of all, you must have incurred the disability before the age of 26. You can open the account at any age as long as the disability began before the age of 26. While that age limit may be disappointing to some, we're happy to report that starting in January of 2026, the ABLE Age Adjustment Act will take effect, and this will increase the age limit from 26 to 46 and will open the plans up to an additional 6 million more Americans. Disabled veterans and individuals who have incurred spinal cord or brain injuries after the age of 26 are just a couple of examples of people this will be opened up to. In addition to the person's age at the onset of a disability, the disability must also be long-term, which for our purposes means lasting longer than 12 months. And it must cause a marked and severe functional limitation. If you have questions about whether or not your condition qualifies, you can check on the Social Security Compliance Allowances list or on the Blue Book. And those links are listed on your screen. You must also meet the following criteria, one of them. You're eligible for Social Security or disability due to your disability, or you have a disability diagnosis from a physician and a copy of that diagnosis. Please note that being eligible for Social Security or disability is only one of the two options. You do not have to be on public benefits to open an ABLE account, and you only have to meet one of these criteria to qualify. Additionally, you do not need to be working to be eligible to open an ABLE account. Next slide. You may have a loved one who would benefit from this account, but they're not able to manage the account on their own. We do have a few options when it comes to managing accounts. If an eligible adult has the legal capacity, they certainly can and are encouraged to open and manage an account on their own. If they do not have the legal capacity or would like someone to assist them in administering their account, they can have an authorized representative open the account on their behalf. The authorized representative can be anyone from this list: power of attorney, conservator, guardian, spouse, parent, sibling, grandparent, or representative payee. The authorized individual could be a person or an organization. This list has been put in a very specific order, and this list is hierarchical, which means that in order for a person to act as the authorized individual, everyone listed above them on this list must waive their right to open an account on the account holder's behalf. For example, a representative payee would need to check with everyone else on the list and make sure that they would not want to open and administer the ABLE account before the rep payee could open one on the account owner's behalf. Next slide. I mentioned earlier that those of us here today represent directors from all over the United States, and that's because there are multiple ABLE plans. There are 46 states plus Washington, D.C. that have ABLE plans. We all encourage you to check with your state first to see if they have a plan, and if so, what incentives the plan has for its residents. Some incentives may be offering state tax deductions or tax credits for residents, or some states offer plans with no annual maintenance fees for their residents. Some states also offer nationwide plans, so you can research those plans as well. We understand that everyone's situation is different and want people to educate themselves and pick the plan that works best for them. You can research all the different plans at abletoday.org/able-programs. This address is also listed at the bottom of your slide. They have a comparison tool for you to use there also. If you want to do a deep research on the different plans, each plan also has their own program disclosure statement located on their website. If you have opened an account in one state and have moved and decided your new state home state's plan is better, or just decided a different plan would work better for you in general, you are allowed to roll your account from one plan to another. At the end of the year 2022, there were more than 137,000 ABLE accounts with more than 1.25 billion in assets. While this is quite an accomplishment in the short 7 years the program has been in existence, we know there are lots more people we need to reach to help them to start investing in their future. We're hoping that all of you can help us spread the word about these great accounts and take this information back to the groups that you're a part of and help this program to grow. We also understand that all the different numbers we throw out can be confusing, so let's take a minute to go through them. $100,000 is the limit of an ABLE account when it comes to keeping eligibility for Social Security. The $100,000 is in addition to other allowed assets account owners may have, cash or other accounts, etc. While $100,000 may be the Social Security limit, it is not the account limit. Account balance limits vary from state to state and are anywhere from about $300,000 to $500,000. $17,000 is the annual contribution limit, which means that $17,000 is the maximum amount of money that can be contributed to an ABLE account each year from all sources. There is an exception to this if the individual with a disability is working and the employer is not contributing to a retirement account for them. They can participate in the Able to Work program and save an additional $13,590 in the 48 contiguous states and DC, $16,990 in Alaska, and $15,630 in Hawaii. And now let's talk more about the advantages of an ABLE account. Sorry, next slide. We just spoke about the $100,000 Social Security cap. Medicaid does not count any assets in the ABLE account, so there is no balance cap when considering eligibility for Medicaid. It's a more flexible alternative for some special needs trusts, though ABLE accounts and special needs trusts can and often do work well together. You don't have to spend down to avoid asset caps. Instead, move money to your ABLE account. Anyone can contribute to an ABLE account, and for some states, contributions may also capitalize on tax benefits for their own contributions. Contributors can capitalize on tax benefits, excuse me. As we mentioned earlier, if an account owner is working, they can save even more than the $17,000 through the Able to Work program. Next slide. We've got a few more key pieces of information we want to make sure you're aware of. The person who is eligible for the account is the account owner. While others may assist an account owner in managing their account, they have no beneficial interest in the account. There's no limit on the number or amount of withdrawals for qualified disability expenses. Any earnings and withdrawals on these accounts are tax-free as long as they are used for qualified disability expenses. It's also important to note there can only be one account per individual nationwide. If two accounts were opened in error, or if you wanted to change plans, you can roll these accounts into other plans. While each plan does its best to keep our fees low as possible, there are costs associated with administering these plans. These fees vary from state to state, so be sure to check your plan's disclosure statements for what the fees may be. There's also a minimum amount to open an account. These also vary from state to state. The highest amount would be $50. Many people have questions about what happens when an account owner passes away. One thing to remember is that final expenses are a qualified disability expense. You'll want to first make sure that all qualified disability expenses are paid. If there's a balance left after that, what happens varies from state to state and by situation. It could be taken back by Medicaid, it could be paid out to an estate, it could go to another ABLE account. Always check with your state's plan and with a probate attorney to make sure you understand what will happen with your account. Next slide. Once you've determined that you're eligible and you've found the plan that's right for you and you've worked with that plan to open your account, the next step is to fund your account. There are several ways to accomplish this. It can be deposited electronically or by check, including gifts, inheritances, insurance settlements, and distributions from special needs trusts, as long as it all stays under that $17,000 cap per year. Many plans also have gifting platforms to allow friends and family to easily contribute. You can also set up direct deposit with many programs to allow paychecks and or Social Security benefits to be deposited. Additionally, you may roll funds over from a 529 college savings account or from another ABLE program. You can go to able-today.org/able-program-direct-deposit for a list of direct deposit forms for all ABLE programs. Next slide. It is important to note that ABLE accounts are an asset shield, not an income shield. So as you participate in Able to Work or direct depositing your paychecks, please do remember that this income will still be counted towards your income limit, but not towards your asset limit. Gifts deposited into ABLE accounts do not count as a Social Security resource or income, and any earnings made on an ABLE account do not count towards your income limit. There is a specific rule about housing to keep in mind, though. The money from an ABLE account needs to be spent in the same month as it is withdrawn, or that could be counted as income. So don't pull it out on the 30th and try to pay your rent on the 1st to make sure you're using it in the same month. Next slide. You've heard me talk about qualified disability expenses a few times and are probably wondering what those are. These expenses are incurred as a result of a disability and are intended to help maintain and improve health, greater independence, and quality of life. They include housing and rent, assistive technology, basic living expenses, financial management, oversight and monitoring, employment training and job coaching, transportation, healthcare, prevention and wellness, education, legal fees, funeral and burial costs, and personal support services. Lots of you may be thinking that these are some pretty broad categories, and they were created that way to allow for a wide range of expenses. The most important thing to remember for qualified disability expenses is to make sure you're keeping your receipts and keeping good records of your qualified disability expenses. That way, if you're asked about a specific expense, you'll have a good and clear backup to show how it was qualified. Another thing to keep in mind is that assets purchased with money from ABLE accounts, for example, a car or a house, yes, people have been able to buy a house, cannot be counted as assets when applying for benefits. Another big question is, what can ABLE money not be spent on? Gambling is a good example of something that ABLE funds cannot be spent on. Also, gifts could be something not considered an eligible expense depending on the circumstances. A good rule of thumb is to imagine someone from the IRS sitting in front of you wanting to know how to connect the money you spent to one of the qualified disability expenses. If you have a difficult time explaining that, it might not be a good idea to spend it on that. Next slide. Now that you know what you can spend it on, let's talk about how to spend it. Depending on the plan you choose, your options will vary. Checkbooks, debit cards, third-party checks, and bank transfers are some of the ways you'll be able to access your funds. Please check with your program administrator and the program disclosure statement for guidance. Next slide. I hope that if you've gleaned anything from this part of the webinar, it's that it's important to read the program disclosure statement. There is so much good information in these documents, and it can really help you understand how the program works and make good decisions for yourself. Any updates a plan makes will also be added here, so it really helps you to keep up to date with changes as well. To find your state specific information and program disclosure statement, you can go to abletoday.org/analyze-able-programs Click on your state on the map and check out the details. There are a few states that do not have programs right now, South Dakota, North Dakota, Wisconsin, and Idaho. So people in those states will want to check out programs that are available nationwide. Now we're going to transfer over to my colleagues, and they're going to help answer a lot of the great questions that were from our last webinar.
Stacy Pfeiffer, thank you again from Nebraska for the presentation. Really appreciate it. Please stay by because we have more questions. We hope to have your expertise on here just in a little bit. Chris, on the next slide, we'd like to go ahead and transition to the question and answer session. Again, we received 700 questions during and following the Social Security webinar that we had hosted in February. We wanted to directly follow that up with a live webinar resource today. Many of the questions and answers you're going to have coming in the next couple of slides are exactly those that were presented by attendees like all of you during that session. So thank you again for giving us the questions. Hopefully we're going to be able to answer as many as possible. For the future though, please reach out to us via info@abletoday.org. We have many resources, including the recording of this webinar and that Social Security benefits webinar on our website. Though, if you would like to have a presentation for your community, your office, your disability organization, please reach out. Let us know how we can be helpful. And with that, I'd like to reintroduce Eric Jimenez, Brittany Chipley, and David Bell. We're going to have a very interactive and engaging conversation where each one of them will be presenting answers on the questions that were provided previously. And on the very next slide, Brittany will be starting us off talking about more details in relation to ABLE eligibility. Brittany?
Thanks, Eric. Good morning or good afternoon to everyone out there, depending on where you are. So we had great questions in regards to eligibility. I'm just going to go through each question and then answer them. The first question is, my disability began before age 26, but I do not have records from that long ago. How do I prove my eligibility? My disability began before age 26, but my SSI or SSDI date of disability, and I take that date of disability as the Social Security Administration's established onset date, so that's how I will reference my answer, is after age 26, am I ineligible for ABLE? And the last question is, for the list of eligibility requirements, is it an list or an or list? Do I have to meet everything on the list or just one item? Let's first reiterate what Stacy covered about ABLE eligibility, and then I'm also going to give you an example to kind of help you out, understand it a little bit more. The first main criteria to be ABLE eligibility is to have a disability that occurred prior to 26, plus one of the following. Number one, eligible to receive SSI or SSDI due to a disability, or have a disability diagnosis, physical or mental, from a physician and a copy of that diagnosis. Let me just give you a quick example. Say like you have a gentleman, he's 30 years old, and he believes he's suffering from some type of mental disorder. He goes to the doctor at the age of 30, and the doctor goes through everything he needs to go through to come up with the diagnosis. And he actually says like, yes, you do have a mental disorder, but your mental disorder actually developed when you were 25. This young man at the age of 30 will be eligible to open an account because even though he's 30, his mental disorder developed or occurred at the age of 25, which is prior to age 26. Moving on to question number 2 in regards to the, well, actually we're gonna move on to the question in regards to the records. If you don't have any past records, please know that while a copy of a physician's disability diagnosis is required, it does not have to be from the physician who originally diagnosed you. It can certainly be a current physician. So if someone has a disability that began before the age of 26, but their SSI or SSDI, referencing the second question, that established onset date is after the age of 26, the individual will still be eligible for an ABLE account. The established onset date, which is called the EOD date, is the date that Social Security determines that someone became disabled and unable to work. However, but the EOD is not simply the first date the claimant met the medical criteria for disability. Next slide, please.
Thanks, Brittany. David Bell will be joining us now from Oregon, highlighting ALRs and how they can help administrate the accounts. David?
Thank you, Eric, and thanks, everybody. It doesn't surprise me that there are a lot of questions. This is all very important, and we want to make sure that we get this right. So I appreciate everybody asking these questions. I also appreciate everybody allowing us to say these sometimes multiple times, because it's helpful for us. I think it's helpful for you as well. So I'm going to cover some of the things that were covered by Stacy earlier, specifically in regards to authorized legal representative, what that means, who can be one of these individuals. But then also I might repeat myself in a second, because I'm also going to talk about something that we refer to as the hierarchy. So the authorized legal representative is actually a term that is tied to ABLE and ABLE accounts. I do want to clarify the legal part of this is tied to the fact that the IRS has kind of identified these individuals. It doesn't mean that that person always has some form of a legal document proving that they can be an authorized legal representative. But I'm jumping a little bit ahead. Let me just explain what an authorized legal representative is. It's a long term. We tend to use an acronym, ALR, on this one. But really what all this means is that this is a person that can manage the ABLE account for the account owner. And you'll remember that with ABLE, the account owner, the person who experiences the disability, is the account owner and the beneficiary. So the person that can manage the account for that person, if chosen, is what's referred to as the authorized legal representative. So that's what we're talking about right here. So people had questions in regards to who could be this and how does it work. So can a spouse be named as an ALR? Again, ALR is the authorized legal representative on my ABLE account, and the answer is yes. I'm going to get into details on why the answer is yes here in just a few minutes when we go through the hierarchy, because there's two reasons why a spouse could be an ALR. So hold tight on that. The easy answer is yes. Second question here, can more than one person or an entity act as an ABLE account ALR? Let me answer the last part of that question first. Can an entity, meaning an organization like a nonprofit organization or a support organization, act as an ALR on behalf of ABLE accounts? And the answer is yes. You'll want to check specifically with your ABLE plan or the ABLE plan that you're interested in opening on how exactly this works. There's slightly different processes, but absolutely, the organization itself can then act as an ALR on that account. Now, the first part of that question gets a little bit more tricky. Can more than one person be the ALR? For instance, could a father and a mother both be officially the ALR for one account? And that does get a little bit more tricky. Part of the answer is going to depend on which ABLE account you work with. I know there are many out there that will only allow one authorized legal representative, and there's a whole host of reasons on why that would be important for the management of the funds, et cetera. But that doesn't mean that others within the family unit can't support that individual and help in other ways. But many times, just one ALR per account. What's the process to change this ALR, or what happens if the ALR, again, authorized legal representative, what happens if they pass away or if you just want to change? Each ABLE savings plan will have a process for you. I can speak clearly to the one that I work with. There are some forms, or actually one form that would be filled out, regardless of whether you're just changing the ALR or if the ALR passes. Now, depending on whether you're just changing or if the ALR passed, there might be some supporting documentation that goes with this. If you're ever in doubt, you can always call your ABLE plan, the toll-free number. There are a lot of experts there waiting to make sure you have the right forms, you know exactly what to do. So it's easy to do. It just takes a form in this case. This is usually not something that can be done online through your management portal because there needs to be some documentation that changes hands there. Lastly, are multiple accounts, how are multiple accounts handled under one ALR? So in this case, and I'll wrap this up quickly because I want to move on to the hierarchy part. If one person serves as ALR for multiple individuals, usually they will have access to an online dashboard that'll allow them to see all of the individuals for which they're managing. So they can do most of the management just online. It would almost be as if you had multiple bank accounts that you were managing, a checking account, a savings account, maybe. You would see individuals under the same portal. You're going to want to make sure you're checking with the ABLE plan that you work with to see exactly how you can manage these multiple accounts. We know that many people do manage multiple, and we're trying our best to make this as easy as possible for you. So let's dive into the next slide, which focuses more on the hierarchy, which is still perfectly tied to authorized legal representative, because that's where this comes into play. So not too long ago, the IRS came out with some updated or final regulations for us that are supporting ABLE plans that create a little bit more detail when it comes to who can actually serve as an authorized legal representative. I want to be crystal clear here. Stacy mentioned it, but I think I should say it again. When you're deciding who should be the authorized legal representative, I think you should start in this line. First, ABLE accounts were designed from the very beginning to be an empowerment tool for the person who is experiencing disability. When it is all possible, having that individual manage their own account is very empowering. And something that I think should be looked into. So the person can manage their own account. If they choose not to manage their account because they don't want to, or maybe they can't, they need the support, that person can identify who they want to serve as their ALR, as long as they have the capacity and the ability to do that. So if there's an individual, they can choose. They might choose their spouse, going back to the question on the other slide. They might choose their best friend. They can choose anybody to be the ALR for their account. Now, that's covering A and B here. The hierarchy really comes in for those individuals that are a minor, they have not reached the age of majority, or an individual that can't make this decision. That's where the hierarchy comes in. So the IRS has allowed us, ABLE states, to list individuals that can serve as ALRs if the account holder cannot make that designation themselves. And it goes in this order. The first person would be a person that has power of attorney. That is a legal document. You would need to fill that information out, have that properly notarized in most cases, and hold on to that. You're going to be attesting in most cases with these ABLE plans. You'll be attesting that, yes, I have the information I need here. But that would be the first. Then it goes down the line, a conservator or a legal guardian, spouse, parent, you can see these on the slide, sibling, a grandparent, and then a representative payee. These are not just a sampling, this is the list. So if the person can't make this delineation themselves, this is the list that you would be following. If you are the grandparent, Stacy mentioned this, you would need to make sure that nobody further up in the line was willing or wanted or able to manage this account on behalf of that individual. Doesn't mean that they're not there, but they're not able or they're not willing to do so. Representative payee is probably a big one here. I'm guessing there's quite a few representative payees on this webinar right now. Yes, you can manage the ABLE account on behalf of that individual. You just want to make sure that nobody higher in that list is doing that. And then you are the one that would be in line for managing that account. Eric, before we move on, I want to cover there were some questions tied to hierarchy. I'm not going to go through all of them because I think we answered most of them here, but I just want to make sure that we're covering this. Some of them were tied to the power of attorney. I think we covered that just right there. The documentation was a big one. People were asking, what documentation do I need? Well, in the case of most ABLE plans, we're not going to require you to upload this documentation. Sometimes they will. You're going to want to check with the ABLE plan that you're working with to see if they do, but you are attesting that you have the legal documentation. In this case here, the only people that are going to have documentation would be the power of attorney, the conservator or the legal guardian, or the representative payee. If I'm a spouse, I mean, I guess maybe I have some sort of a certificate, but of marriage or what have you, or being the spouse. That's not what we're talking about here. So we're just talking about the actual documentation. Hold on to it. If your ABLE plan requires this, you'll be asked to send it in or upload it. Many don't. They're just having you attest that you have that. I'm going to go ahead and skip the rest of the questions, Eric, just because they were addressed here. We'll make sure to go back if people have additional ones. I want to make sure there's time for everybody.
So on the hierarchy and really on ABLE eligibility, we've tried to group all of the different questions together. So thanks again, David. We're going to shift over now back to Brittany from Arizona's AZ ABLE program as she goes into more details now on representative payees and how they interact with an ABLE account. Brittany?
Thanks, Eric. So let's dive into these questions in regards to a representative payee, or for short, we call it a rep payee. So the first question here says, does a rep payee need a parent or guardian's permission before opening an ABLE account for a client? Let me first answer this question by also discussing what exactly a rep payee is. So when people need help managing their money, Social Security Administration will appoint a suitable representative payee, a rep payee, who will manage payments on behalf of a beneficiary. Generally, they will look for family or friends to serve as payees. However, when friends or family members are not able to serve as payees, the administration will look for qualified organizations such as a Social Security service agency or a nursing home. The administration also offers the option to advance designate up to 3 individuals who could serve as a payee for an individual if the need arises. So moving forward to the next question. Does ABLE account information need to be included on a rep payee report? The law requires some, but not all payees to complete an annual representative payee report. However, all payees are responsible for keeping records of how payments are spent or saved and make all records available for review if the Social Security Administration requests it. Those records can include ABLE account information. The next question is, can a rep payee transfer SSI overages into an ABLE account? So this is a little tricky. I will not say yay or nay because it is possible for someone to transfer an SSI into an ABLE account without knowing there has been an overpayment. So what I will say is SSI overpayments occur when the Social Security Administration believes someone received more money than they should have been paid. So what happens is SSA will send a notice explaining the overpayment, asking for a full refund, usually within 30 days. And then from then forward, the process can be, it can go different ways. It can involve reconsideration, an appeal, waivers, withholds, etc. If there is a minor child receiving foster care benefits and the state is or was the rep payee at the time of the overpayment, the Social Security Administration advises individuals to contact them in such a circumstance. As for the last question, if I am no longer the client's rep payee, what do I do with the ABLE account? You don't do anything with the account. Contact your ABLE program plan administrator and let them know. A payee must also tell Social Security Administration if there are any changes that might affect his or her ability to continue act as a rep payee, and so that the administration can take the necessary steps from there. Proper steps will then be taken for the establishment of a new account administrator. Next slide, please.
We've grouped all of these first slides into account eligibility and account management. And to close out the final part of it, David Bell will go into some more specifics on the account.
All right, thanks again, everybody. There were some questions around using paper applications, and that is completely okay. Just to let you know, ABLE accounts don't usually, for the most part, Again, there are certain things that are cut and dry for every single ABLE plan because it's tied to some sort of a federal legislation or an IRS rule or what have you. There's other things that depends on the ABLE account itself. For the most part, ABLE plans don't have brick and mortar sites that you can go into. There are a couple of exceptions, so you'll want to check with your ABLE plan. Most of this is either handled online, which is where the vast majority of opening accounts and managing your accounts takes place. But there are also paper forms for those individuals that would rather handle it that way. And there are a few things that you need to do with your ABLE account that require a paper form, because it usually is accompanied by maybe a notary or something to that effect, because it's an important change. We need to remember these are individuals' money. We want to make sure that we are protecting it, and that's why some of those rules and restrictions are there. But yes, you can use a paper application, and people were asking, well, how long does it take to open up an ABLE account with a paper application? And that is a difficult question to answer because there are then a few parties involved here. Filling out the actual paper application shouldn't take you that long. It is a little bit easier to do online, but the paper application is there and you fill out the information. Depending on if you have everything in front of you that you need, you're going to need some information for the beneficiary, the account owner. You're going to need some information for the authorized legal representative if that's who's choosing to if there is one tied to the account, and some other information choosing where and how you're saving the money, etc. Filling that form probably won't take you that long. Then you need to go ahead and mail that, have that go from wherever you are to wherever the program manager, these are the partners that states use to administer these programs, so that they can then get the paper and process it. There's a long way for me to say it could take, let's just say it could take 1-2 weeks for this to open. It purely depends on how quickly the mail gets to the program manager, how quickly that's processed and they get that into the system. Making changes to your ABLE account really is easy. We really wanted this to be an empowerment tool. And I believe there's been some questions in the past, and I bet you there are now, well, how difficult is it to manage an ABLE account? Because I need to know that, whether we're making a decision on whether the account owner and beneficiary manages it themselves, or if it really does need an authorized legal representative. And it really is pretty easy to manage these accounts. And remember, maybe that individual just needs some supportive decision-making support. All of us need some support in our lives. We need to ask some questions here or there, and they can do that with individuals and not have any ALR attached to the ABLE plan. Some will or will choose to need one. So you can make most of your changes right there through your online portal. You'll set up an account login. You can get in there and you can transfer money easily, deposit money easily, make some basic changes, and every once in a while there'll be a change that we require a form. There is a federal rule tied to just one ABLE account per person, and I think there are some questions on this. This is something we can't change. This is part of the federal statute, the federal law. Only one ABLE account per beneficiary or account owner. There are a whole bunch of reasons I believe they set that in motion for, but we don't have time to get into that today. So it's just one per person. So just keep that in mind. Now, here's a big one, and one that would be impossible for me to fully answer, but I think I should at least address. How does someone select the ABLE savings option or investment option? Now, depending on the ABLE plan that you're working with, there's going to be a number of options for you. Let's say anything from maybe 4 options up to 7, 8, maybe even more options. Many times you might just want to pick one savings or investment option. Sometimes you might want to split up the options into maybe two places. For instance, actually, I believe all ABLE plans will have some sort of a FDIC insured or almost like a bank option, almost like a checking account or a savings account at your bank. It's not invested in the stock market. For instance, the FDIC insured option, that might be a place where somebody might want to put some of their funds and save some of their funds for whatever reason they choose. Maybe they're going to be using those funds on a more regular basis, or maybe they're just a little nervous about having their money invested. Individuals can choose some investment options. These savings plans have worked hard with investment professionals to pick a right mix, and they might choose that they want to have their funds invested in different type of investment portfolios. You'll want to read the information. There's so much good information in these program disclosures and on our websites to make the right choice. And many of the savings plans have also included some information to say, hey, if you plan to use the money this way in this time frame, you may want to select this option. If you choose it here, you may want to do this. And remember, you can do multiple, and many people do. Thank you, Eric.
On the next slide, we're going to transition over now to contributions and funding the ABLE accounts. And Brittany is going to walk us through exactly some of the limits attached to an ABLE account.
Let me take myself off mute here. Thanks, Eric. Okay, so we received a plethora of questions about funding limitations. So how much can be contributed to an ABLE account? What types of money can be deposited into an ABLE account? And are there any Social Security benefits affected when an ABLE account reaches a certain balance? Okay, so let's first talk about the types of money that can be deposited into ABLE accounts. Contributions can be made in the form of cash, check, electronic funds transfer, money order, credit card, gift of an independence card, which is a gift card that has no expiration date, and or after tax payroll deductions. Moving forward with the funding limits of an ABLE account. The maximum annual contribution limit for 2023 calendar year is $17,000, and that is from all sources. The $17,000 comes from the gift tax exclusion law, which means the federal government exempts this amount from tax, and it can vary from year to year. Contributions can be made by an individual, a trust, an estate, a partnership, association, company, corporation. Most, if not all, program systems automatically reject excess contributions, so you don't have to worry about tracking or exceeding an annual contribution limit. Say like grandma is the first contributor to her grandson ABLE account, and grandma sends a check in for $20,000. The system is going to reject that $3,000 because her grandson is not working. He's an account holder who's not working, and his maximum annual contribution limit is $17,000. Now let's talk about the maximum lifetime contribution limit, and that varies from state to state. I've seen it as low as $300,000 upwards to $500,000 plus. This limit is based on a state's 529 education savings plan limit, and it can adjust periodically, typically increasing every year. Contributions would not be accepted once an ABLE account reaches that state's maximum lifetime limit. However, earnings can continue to accrue, increasing the balance beyond the lifetime limit. Moving forward, talking about the Social Security, the SSI limit balance limit. So there is a caveat if you are an ABLE account holder who also receives SSI. If an account owner has an ABLE account and is also receiving SSI, and the account balance goes over $100,000, the amount over the $100,000 will count as a resource. So Social Security Administration will suspend the account holder's SSI, but not terminate it. Once the balance drops below the $100,000, the account holder does not have to reapply for SSI, but we will need to certify Social Security to regain SSI benefits. Next slide, please.
Thanks, Brittany. I want to acknowledge the most patient panelist we have, Eric Jimenez, who's been waiting eagerly to get started on his slides. We have a very, very detailed explanation on how inheritance works and gifts into the ABLE account. So Eric from the Nevada State Treasurer's Office, again, thanks for joining us.
Thank you for having me. Again, my name is Eric Jimenez. I'm a Chief Deputy in the Nevada State Treasurer's Office. And I'm also the highest ranking person in our state government with a disability. So we're super excited about these accounts and how they can change lives for people with disabilities. I know we're approaching the hour mark, so I'll try to be brief with my stuff. And I think some of this has been answered. But as Brittany had mentioned and David had mentioned, yes, gifts can be accepted into ABLE accounts. I think this is one of the evolutions of what we've seen in the types of assets going into ABLE accounts. Traditionally, when the bill was passed, the ABLE Act was first passed, we were thinking about how could individuals with disabilities and their families save for them and help them kind of grow for a better future. Naturally, that evolved, and we had family, friends, grandparents saying, well, how can I help that child or that individual with this disability start to save? And you will see that most, if not all, plans will have resources to help facilitate gifts into ABLE accounts. Just speaking from our own plan here in Nevada, which is part of the the National ABLE Alliance, there's a platform called UGift, which allows people who have ABLE accounts to set up a quick code, and money can be deposited on behalf of anybody really into that ABLE account. The one thing I will stress is we need to make sure that we're not going above that $17,000 annual limit. Your plan administrators do their best to kind of monitor these things, but if you are thinking about making a gift into an ABLE account or accepting gifts into an ABLE account, you're going to want to watch that annual limit because you don't want to unintentionally disrupt benefits. I think this is a good point to mention that ABLE accounts, while they're fantastic vehicles for savings and kind of more regular expenses, they are not special needs trusts, and they do function differently. While there are benefits to special needs trusts and there are benefits to ABLE accounts, I think it is important for people to think what the individual might need and what the long-term planning for that individual is. If there is a large inheritance coming to an individual and you're worried about what's going to happen to my child when I pass away, it may make sense to set up an ABLE account for a small portion of those dollars. But it may make sense to set up some sort of a special needs trust for large amounts of assets and property and things like that. Because what we don't want to do is unintentionally break those benefit caps into the ABLE account. And that should be something we think about when we think about gifts and inheritance. Sometimes inheritance, depending on the dollar amount, may not be the best vehicle or the best use into an ABLE account. And then it was mentioned by Stacy earlier, but gifts, as long as they are below that $100,000 threshold, do not count against the resource limit. But one more time, we need to make sure that we are thinking about that $17,000 annual contribution and the $100,000 balance limit. And with that, I think I'm done for now.
Yeah. On the next slide, we'll transition back over to David from Oregon, again highlighting the contributions into an ABLE account.
All right, conscious of time. So the answer to a lot of these is yes. SSI payments can be direct deposited into ABLE accounts. I think the best thing to do is just check with the ABLE savings plan that you're working with to find the best method in order to do that. And you can split up some of those payments or even an SSI DI payment between ABLE account and the bank account. Many times they have that money go into the bank account and then move a certain portion of that over into the ABLE account. Those answers are yes, absolutely. There are some very specific questions about depositing checks into an ABLE account that were actually endorsed to the account owner, not to the actual ABLE savings plan. Call your ABLE savings plan. I know that we have worked with individuals to do this. There is a process. The best thing to do in this case is call them and find out exactly what you should do. More often than not, they will be working with you to do that. There pros and cons of putting direct depositing paychecks into an ABLE account. There's probably quite a few of pros. Maybe there's a couple of cons. I think the only thing you need to really figure out, because once that money is in there, you still have access to use it when and how you want to. And it's going to allow you to stay under that asset limit. I guess the only thing I would just caution an individual is to say, make sure that you are leaving enough room, knowing that there's an annual contribution limit, which is currently $17,000. Leave enough room in there so that you're not becoming over-resourced later in the year. Managing your account, like changing your systematic payments, that can be done online. You can also sometimes call the call center. They can help you with that. And there is a form for it, but it's really easy to do. And if you needed to reverse a contribution that you put into your ABLE account, some ABLE plans have part of it in their portal where you can reverse it as long as it's done at a certain amount of time. You can't wait too long because that payment will be processed. Otherwise, I would suggest calling the ABLE plan right away as soon as you realize this and see if you have time.
Yeah. Brittany's going to talk more on the next slide about ABLE to work contributions. Again, we had nearly 600 live attendees on this webinar. If you happen to have to leave because of your schedule, this recording will be available. We'll be emailing out to everyone. There's lots of great questions still coming up. We're trying to do our best to answer very detailed information into all these questions. So if you can stay, great. If you need to file the recording, they'll be posted online. So Brittany, if you want to get going on Able to Work.
All right, thanks, Eric. So let me go through these questions really quick, and then I answer them basically all in one. Do you have to be working to have an ABLE account? Can you explain able to work? Can you deposit a working beneficiary wages or entire SSI check into an ABLE account, including personal expense deductions? First, let me reiterate, you do not have to be working to have an ABLE account, and the type of occupation you have does not dictate whether you can or can't participate in Able to Work. Now, let me explain what Able to Work is. The Able to Work Act provision was passed as part of the Tax Cuts and Jobs Act of 2017, and it allows certain ABLE account owners who work and earn income the opportunity to contribute above the annual $17,000 contribution limit. To be eligible, the account holder or their employer cannot contribute into a defined contribution plan, an annuity contract, or an eligible deferred compensation plan. The account owner can contribute compensation up to the poverty line amount for a one-person household, which is $13,590 in the continental US. And as Stacy talked a little back, ways back in regards to if you live in Alaska or Hawaii, it can be higher than that $13,590. So this basically means that if an ABLE account owner who is working can potentially save up to $30,590 if they're living in the continental US, and even more if they're living in Alaska or Hawaii. If someone continues to be eligible, contributions can be made each year through the end of 2025, which is when the Able to Work Act provision is set to expire. So for the last question, can you deposit a working beneficiary wages or entire SSI check into an ABLE account, including personal expense deductions? You can deposit a working beneficiary wages or their entire SSI check into an ABLE account. However, you should understand that if you are an ABLE account owner and you are receiving SSI, your wages will still count as income, even if they will be contributed to your ABLE account. And that is because benefits have two thresholds, like Stacy mentioned, that number one, that asset resource threshold, and then number two, that income threshold. Assets must be below a certain amount, and income must also be below a certain amount. ABLE accounts help people exceed asset limits, but do not change or assist people overcome current income limits. Lastly, examples of payments. I just want to mention this. There's examples of payments that may be direct deposited into an ABLE account, but are still counted as income. And those not only include wages, but they also can include benefit payments such as pensions, mandatory support payments such as child support, alimony, and sometimes and certain settlements. Just keep that in mind.
And Brittany, I wanted to conclude your slide with the fact that the ABLE Act passed in 2014. And one of the great add-ons to it is this Able to Work function. I mean, it is a true separate bucket of contribution, but allowing people with disabilities who have an ABLE account to work and put deposits from their wages into it on top of the everyday, any other way contribution. So imagine again, somebody who might be on a benefit who had a limit of $2,000 now being able to put in up to $30,000 in the two different buckets. Able to Work is a great feature and a great add-on, and just as important as the Able Age Adjustment Act, which recently passed, which will go into effect on January 1st, 2026, allowing even more people to have an ABLE account. So thanks, Brittany. It's a really important slide. Thank you. Eric and Manos will be rejoining because again, another great feature for ABLE accounts is that they're not just savings accounts. They are savings and investment tools for people with disabilities. And Eric's going to go into some of the investment side of an ABLE account.
Yeah, I think one of the biggest game changers for folks with disabilities is able accounts were now the first opportunity that many of these folks had to see assets grow over time. For too long, we've been thinking about how can we spend down our assets every month to make sure that we're not hitting those caps so we can keep our Medicaid and Social Security. And now we have a financial vehicle that allows those funds to grow. And this typically is the biggest hang up when people are signing up for accounts. I'm sure many states deal with it, but functionally, when you invest money in an Enable account, you deposit money in an Enable account, that's going to the plan sponsor, which would be a state, and then they are the fiduciary over those assets, and they're being invested with a broader amount of other able participants, and that helps keep costs low and helps fund the program and things like that. Your account funds, by definition, can and will grow over time. I will say I am not an investment consultant, nor am I your investment consultant. So you will have to think about risk for whatever best meets your needs and or your family's needs or your child's needs. So if someone is younger, it may make sense to have a little bit more of a growth strategy or an aggressive strategy with those investments. If you would like, or if you're approaching retirement and you need those funds later in life, it may make sense to have a more conservative strategy. And I think the best way to figure that out is to talk with your plan that you're considering and talk with investment consultants and benefit managers to understand what best works for you. And like I said, there are different ways that you can mitigate risk, and a lot of that's going to depend on what your personal tolerance is in the marketplace. Now, we recognize that while people may appreciate the investment option is not for everybody, especially when we see some of the banking situations that we've seen in the last few months, which is why I believe all plans, if not most of them, are offering a debit card option that's allowing this to function more like a traditional checking account, where it would be FDIC insured, so insured by the Federal Deposit Insurance Corporation for balances under $250,000. And because we're following the limits, there would be no reason the balance would be that high. And that would allow an individual with a disability and or their family to use those dollars in an Enable account much more flexibly, using a debit card for qualified disability expenses, being able to go to ATMs to withdraw funds, and really just using it like anybody else would use a debit card for their checking account. But it's really important, figure out what option is best for you. It may make sense to have somewhat of an investment strategy, and it may make sense to have a more traditional kind of checking option.
And for Eric's slide here too, please remember, no ABLE program will be giving you financial advice. We will not be helping you pick investments or savings options. Each person with an eligible ABLE account, their families and caregivers can pick and choose how to save the money or how to invest the money. It also gives you a chance to consider working with a financial advisor on creating a future plan on your finances. So please keep in mind, ABLE programs will not be giving you any advice on the picking and choosing of those options. Next slide, please. David, there are fees. And there are fees attached to prepaid cards, which we talked about, these debit cards and things like that, these features of ABLE account. Probably a good time now for us to transition to talking about some of these fees and what exactly they do.
Yeah, thanks, Eric. This is not one of my favorite ones to talk about. I know when we were working to establish these savings plans after it was passed federally, we were all working the hard as we could to keep these fees as low as possible. I think it's important to know that many states, if not most states, don't receive any type of state funding or taxpayer dollars to cover these programs. Or even if they did, they don't have it ongoing. These savings programs are supposed to be self-funding, and so unfortunately we have to charge some fees. I think it surprises individuals that these fees are higher than, let's just say, a normal bank or credit union account, and there's big reasons for that. I can't get into all of it with the time here, but just need to mention that these programs are quite administratively heavy to support. There's a lot of work. There's a lot of individuals that are calling in because these are complex. Not only how do these ABLE plans work, but how do they interact with each of the benefits that I might be receiving, like Social Security or Medicaid or what have you. They also require complete build outs of new systems to keep the limits, let's say the annual contribution limit or the overall limits in check. So unfortunately, these fees are necessary, and we will work to lower them as soon as possible. Most all ABLE plans have two forms of fees. One is a hard dollar fee that you're paying over the year just to have the account. The other one is a small, what's called an asset-based fee, or a percentage of the amount of money that you have saved in there. And again, we'll work to lower these as soon as possible. And there are some fees for some of the prepaid cards and the debit cards, not all of them, but you're going to want to check with your plan provider, your ABLE plan. And what the decision's been made here is these debit cards and prepaid cards are very different than just your debit card at a bank in some cases, and are more expensive to secure and to manage. Most of the time, these ABLE plans are having to work with a separate group to bring these in. It might be TrueLink or others. And unfortunately, those costs have to be covered. So there are some fees attached with that. There is a lot of benefits of them as well. And I'll just touch on it. I mean, it just makes spending money a lot easier and managing money. You might be the ALR for an individual, and you want to put a little bit of money on a regular basis on that prepaid card so that the account owner can go and spend it. Very empowering. Lots of stories of people utilizing for these financial empowerment and literacy and much more. So there are benefits, but sometimes there are costs. Please check with your ABLE plan to see exactly what that entails.
David, you're going to stay on for the next slide, and it's important to note on the next slide we're going to talk about what happens with the death of an ABLE enrollee. Having only opportunity to have $2,000 at any one time while remaining eligible on benefits. An ABLE account allows people with disabilities to build assets, have a chance to build wealth, and to have a larger estate upon their death. So we need to get into some of these examples here and talk about it. But again, the great opportunity of being able to go from a $2,000 limit to finally having an estate is a great part of what an ABLE account gives people with disabilities, their families, and their caregivers.
Yeah. Thank you, Eric. Yeah, these are not the most popular topics to talk about, but they're important ones and ones we get a lot of questions on. So what happens when an account owner passes? Every single ABLE plan will have a process. But first, I actually would like to address the second question here. Can there be a successor owner to an account kind of addressed before the individual passes? Now, the IRS allows us one kind of group or individual to be able to add as a successor owner and not have any tax situations take place, no penalties or fees. And that is if the ABLE account owner has a sibling that also would qualify for an ABLE account, they can name that individual as the successor owner to that account. And if that person passes, the ABLE plan could work with you to then transfer that money over to that successor owner, that sibling that also would qualify for ABLE, and there won't be any tax consequences. You won't have to pay any penalties or fees on that. So that is an opportunity there. Otherwise, if there is a death of a beneficiary account owner, we will need to make sure that you contact the ABLE plan for which you're working on. I know in the case of ours, there's a form that you'd be filling out. There's some documentation that you would need to present, because again, these are legal accounts that have money in them. We want to make sure the money's getting to the right place. Once that information is filled out with that information, we would then be moving the money over to that family or the right person. It is important to say, though, and it was mentioned before, when a beneficiary dies, you can still use the account to pay for any qualified disability expenses that still happen. For instance, somebody may still owe rent in a house, even though they passed. Before that, you can kind of get out of the rental property, or maybe it's another type of expense. You can actually pay that as a disability expense, even after the beneficiary has died, before that money is then transferred over. Another thing that you can spend the money on is funeral and burial costs, which I know is different than some other accounts that individuals have used in the past. Then they can process that change of payment. So Eric, I think I better stop there, even though we could talk much more about this process. It's important. Contact your ABLE savings plan for more information.
Yeah, it's great info sharing. And along with the next slide, Britton will talk about Medicaid recovery and how it connects back into an ABLE account. Again, ABLE programs have great information to share. We want to make sure that if you enroll, you don't feel that somebody got you. And so we're trying to make sure we provide all this information up front and answer these questions so you have all the great information you need to be able to make a decision on whether or not able accounts work well for yourself or for your loved one. So on the next slide, Brittany, if you want to come in here, or I think maybe it's Eric, talk about Medicaid estate recovery.
Yeah, I think I have this one. I think I drew the short straw, but I think this is one of the most important issues and one that we hear about all the time from the disability community. So what is Medicaid recovery? Pursuant to federal law, under certain circumstances, Medicaid can seek repayment for some of the costs and services that have been covered by Medicaid after a Medicaid recipient dies. This is an extremely complicated issue. This does not mean that all of your assets in an ABLE account will be subject to Medicaid recovery. I think it's just important to have conversations with your state Medicaid department, your Attorney General's office, and the program administrator for your individual state. So what happens to funds in an ABLE account when an individual passes away? As David mentioned, the funds in an ABLE account can be used for any outstanding qualified disability expenses, including funeral and burial expenses. So this could be healthcare costs, housing costs, funeral and burial expenses, and they do not have to have been already paid. So if like a cost was incurred but not paid yet, it could be paid out of that ABLE account prior to any sort of Medicaid recovery situation. Your plan can advise you on what may be needed, such as a death certificate or other special forms that may be needed to complete when that happens. If you've never received Medicaid, recovery is not an issue for you. So don't think that Medicaid is coming after your dollars if you're not a Medicaid recipient, if you're only on SSI or some things like that. There are certain circumstances where state Medicaid programs are required to recover certain benefits paid on behalf of the Medicaid enrollee. There are some situations where they're not, and it's kind of optional. For individuals who are aged 55 or older and they pass away, states are required, pursuant to federal law, to seek recovery of payments for the individual's estate, as well as services for nursing facilities, home and community-based services, and related hospital and prescription drug services. And this stems back to some legislation that was passed in the mid-90s, which basically said Medicaid is covering some of these costs. We are recognizing that individuals are benefiting from these services, and how can we start to recoup the cost for the overall program for these services. So largely, if an individual is an older individual and they pass away, there may be a situation where Medicaid recovery would apply. Additionally, and we see this around the country, states have the option to recover payments for other types of Medicaid services, and you'll see that some states are passing anti-Medicaid clawback legislation for their ABLE programs. And while that does direct the State Department of Medicaid not to pursue those recovery efforts in those optional cases, it does not stop the federally required process for those older individuals. As we mentioned before, it is important that if you do have outstanding expenses and they're qualified disability expenses, they can be paid prior to that Medicaid recovery. And then the final piece that I will leave you all with is that states are not eligible to recover from the estate of a Medicaid enrollee who is survived by a spouse, a child under 21, or a blind or disabled child of any age. I think the biggest thing we can leave you with is this is a difficult topic, but it shouldn't be a scary topic. And I think it's important to understand the rules and regulations surrounding Medicaid recovery. But the easiest thing you could do is just talk to folks, talk to your local Medicaid representative, talk to your state plan, and understand what those rules are going into it. So in that event that someone does pass away, you're not surprised.
Thanks, Eric. That's Eric's last slide, and it was a very detailed explanation of Medicaid estate recovery again and how it relates back into an ABLE account. So thanks, Eric. On the next slide, Brittany will close out her portion of the presentation talking about ABLE accounts and taxes.
Eric, you scared me for a second. I was thinking, I know I don't have Medicaid, but I get to talk about I get to talk about taxes. I was like, did I miss something here? But I get to talk about everyone's favorite subject, taxes. So we all know yesterday was tax day. Hope you guys filed your taxes. If not, you filed an extension. But I'm going to be talking about ABLE in taxes. But let me say that I am not a tax attorney. I am not a licensed financial advisor. The answers that I'm going to be providing come straight from the IRS website. So just to let you know, let's focus on the first two questions here. When is the money in an ABLE account taxed, and how are earnings from an ABLE account investments treated when it comes to taxes? So ABLE accounts have, as we've been saying, ABLE accounts are tax advantage savings and investment accounts. There are no federal and there are no state income tax on earnings. Please be advised that earnings in an ABLE account can be subjected to tax penalties if a distribution is spent on a non-qualified expenditure. Contributions to an ABLE account are not tax deductible for purposes of federal taxes. However, as Stacy mentioned previously, some states allow state income tax deductions or credits for contributions made by people other than the account holder. Some states allow state income tax deductions or credits for contributions made to an ABLE account. If there are going to be some third-party contributions, which are contributions made by people other than the account holder, the beneficiary, and they are going to be considered gifts, as we mentioned earlier in several slides. They're considered gifts, and they do not count as resource for income. Now for the following two questions. There are two main, and this pertains to when are 1099-QA and 5498-QA and other tax forms generated? And what do I do if I have questions about what was reported on these forms? There are two main tax forms that pertain to ABLE accounts, and those forms are the 1099-QA and the 5498-QA. The first one is the 1099-QA, and the ABLE program administrator or the program manager must file this form, which reports distributions from ABLE accounts with the IRS on or before March 1st of the following year for each ABLE account from which any distribution was made or which was terminated during the calendar year. A copy of the form, or the IRS says some type of acceptable substitute, must also be given to the ABLE account owner and to each contributor who received a return contribution. As the other form, the 5498-QA, the ABLE program administrator or the program manager must file this form, and this form reports ABLE account contribution information, which also includes rollovers for each ABLE account with the IRS on or before May 31st of the following year. Once again, a copy of this form or some type of acceptable substitute must also be given to the ABLE account owner. If you have additional questions, any additional questions, or you have questions about what was reported on these forms, we always say, please contact your ABLE program administrator. Another great source for ABLE account tax questions is the IRS. I know each year the Department of Treasury creates some type of publication with tax highlights for people with disabilities. I know this past, for those who were preparing their 2022 returns, the IRS had the publication 907, which had wonderful information to help people who have disabilities and also people who have ABLE accounts. So usually I kind of point people in that direction when they're getting ready to file their taxes. So just for future reference, always visit the IRS, because usually, like I said, they come up with some type of publication that has tax highlights for people with disabilities.
Brittany, great last slide. Thank you for that. And then David Bell, on his last slide, we're talking about how able accounts and special needs trusts do in fact work together, and they're great tools in the toolbox in planning someone's finances.
Thanks, Eric. And thanks again to everybody who's on and has been asking questions. Each one of these questions could probably be an hour and a half discussion on its own. So we appreciate you allowing us to go so quickly through this. Hopefully we're providing some guidance here, and do use Able Today as a resource moving forward, building out some great resources and answering these questions. So a lot of questions around special needs trusts and Able. Both are fantastic tools. And yes, you can use both a special needs trust and an Able account. And in many cases, we think that would be a very good idea. Eric and a few others have mentioned the differences here. Special needs trusts come with some opportunities, maybe allowing larger amounts of funds to come in, depending on the special needs trust. And again, this is hard to answer quickly because there are different types of special needs trusts. There's first party trusts, third party trusts, there's pooled trusts, and I'm not a legal expert, and I know that. I'll try to keep it simple. So the benefits of a special needs trust might be, for allowing a larger amount to come in, may allow some real property like a vehicle or even a piece of land to be listed in that trust. Those are things that can't happen in Able. But what can happen in Able is easy access to funds, easy management of those funds, and actually using those funds for some things that many special needs trusts will not allow you to use those funds for. So many times people can have both and utilize that. For instance, the second question here is, can I move money from my trust into an Able account? And the answer is yes, and it happens. We find that individuals on a regular basis, or maybe just one-off, would be moving money from their special needs trust into their Able account. Once it's in their Able account, then that money can be used for all of the qualified disability expenses that fall under Able. It opens up to allow for more of those different types of expenses. Even some of those expenses, this is going to the third point there, that normally would have reduced some benefits. For instance, money for food or for housing. If in the special needs trust, many times if you use money from the special needs trust to cover those two things, it will reduce your SSI benefit. With Able, that's not the case. So you can move money from the trust to Able and then use that money for anything, but including food and housing, and not have that decrease your benefit. So again, I think actually the fourth point there, one of the best ways to use both, I think we're covering it here. Use this to your benefit. They're both great financial tools. Understand them both. Again, we could spend hours just talking about that. Understand the benefits of both, and then you can utilize the benefits together to even have a greater benefit. Eric, I'll stop there and hand this back over to you. Thank you for this opportunity.
I saw one question come in just to close out your slide here, David, about what happens if I already have a trust and I want to make a distribution from the trust into an Able account, again, for a pre-existing special needs trust. And really, I think both of us would agree that you have to possibly, again, talk to the firm, talk to your lawyer. You'll have to amend the trust to allow for a qualified distribution from the special needs trust into the Able account, because many special needs trusts are limited on where the money can be processed from the trust that can be spent on. So you may have to amend the trust. You may have to list the Able account as a receiver of the distribution. I'm assuming I'm taking your words from you, but if I missed anything, please let me know.
That is perfect. Trusts are complex.
Great.
They're legal pieces that do some, and that might be one of the areas that may not be a benefit of a trust. But Eric, to your point's a great one. Many times new special needs trusts that are being created will automatically include ability to distribute funds to Able. But if you are setting out a new one, you might want to make sure that's included.
Well, David, Brittany, and Eric, thanks again for the presentation portion of the Q&A. If we have time at the very end, we're going to take a few more questions from the chat and the question and answer session. So we'll get through the next couple of slides, close out the official presentation, and try to use some of your expertise on more questions and answers. So please stay tuned. On the next slide, we want to make sure that everyone has an opportunity to see some of our great resources we have on our website. So Able Today and the Able program is partnered through Wells Fargo and Communications Service for the Deaf. CSD is an organization. In fact, they helped us have our ASL communicators here today with us. The three groups partnered together to build an ASL Able resource. So it's an entire Able presentation done in first person ASL by people from the deaf and hard of hearing community. It's on our website. URL again is abletoday.org. aba.org/ASL. We posted the February 2023 Social Security Benefits and Able Account webinar on our website. For anyone who's interested and would like to learn more about how the federal agencies have information, including the Social Security Administration, the Center for Medicaid, Housing and Urban Development, and many others, please go on our website at abletoday.org/regulations. We've had a few questions come in about direct deposits and direct depositing money from wages into an ABLE account. If you go to abletoday.org/for-employers, we have every single ABLE program's direct deposit form in a repository on the website. You can pick and choose your ABLE program and be able to have the direct deposit form to hand back into the employer. And then last is our learning module. It's a 10-minute video resource which walks through the basics again and more information on ABLE accounts. So again, great information on our website. Please do try to utilize it. And with that, with this next slide, we want to say thank you for joining us. If you have the opportunity to stick around just a little bit longer, we're going to go through the chat and take some more questions. But again, thank you very much for being here. We had nearly 600 attendees on today's webinar. We really appreciate you joining us and allowing us to give information on ABLE accounts. And we look forward to seeing you again, hopefully at the next ABLE hosted webinar. So we're going to stop here for just 1 second and move over to a general conversation. David, I think you're going to stay on, and Eric as well. So Stacy, I think, is also going to join us. We'll take a few questions here. Maybe we'll just go for about 10 more minutes. But we had a number of questions come into the chat and the Q&A. I'm just going to very casually pick a few of them and walk through a couple of examples here. Stacy, if you wouldn't mind, could you talk about, again, if someone has money in a college savings plan and would like to transfer that money into an ABLE account, and then maybe detail your answer as to if they have over $17,000, how can they transfer that money into an ABLE account?
Sure. Yeah, that's a great question. So yes, if you have a 529 plan, you can roll that money into an ABLE account. No, it does not count towards the $17,000. So you would be able to do that in addition to the $17,000 per year that you're saving. That is a specific law that's been passed recently, and so it does make that exception for those 529 accounts.
Thanks, Stacy. David, there's a question that came in about paying for things like food and books and going out. If someone doesn't use a debit card or feature from the ABLE account, can they use their own personal cards to pay for it? And then can you use your ABLE account money to then pay for that credit card purchase? So if you could just explain again, if you're not using your a debit card maybe or checking feature from an ABLE account, how do you pay back those expenses if you use it in a different way?
Yeah, that's a great question because there are many people that don't utilize the prepaid, the ABLE prepaid card feature or a debit card feature, and that's okay. We're working really hard to make it very easy for you to move money from your ABLE account into your bank account, either to use those funds or, Eric, in the example that you just gave, maybe pay back on another card that they utilize to cover those. The big thing is you just want to make sure that the money that's coming from the ABLE account is being used to benefit the individual whose account it is, the individual with the disability. So they could go out and maybe use some money or a different type of card to cover the expense of the evening for which they just had, maybe food or maybe entertainment, and then they could take money from their ABLE account to cover those costs. That's fine. That's fine. And it's important to remember, and I think it's already been mentioned, that once the money is in the ABLE account and it's protected against those asset limits, even when it's moved back to the person's own bank account that is outside of the ABLE, that amount is protected as if it was still in ABLE. The only caveat is if it is for a housing related expense, it should be utilized the same month that it was withdrawn.
David, I'm going to keep you there. There was a great question on hierarchy. And the question is, if I am a guardian, but not representative payee or conservator, am I able to open and manage an ABLE account? So again, if I'm a guardian, but not representative payee or conservator, am I able to open and manage an ABLE account? Again, this goes back into the hierarchy presentation that you provided.
Yeah, you're literally listed in the hierarchy that was provided to us from the IRS. So the answer is yes. And if you'll remember from the hierarchy, actually the only group or individual that is above that is somebody with power of attorney. So as long as you're sure that there's nobody with power of attorney, and you are then the next in line, even if you are a guardian and not a conservator. And I know there is very stark differences between those, but those specifically were called out in the ABLE IRS regulations for us. So the answer is yes, you can do that.
Great. There was a question asking if we're going to be sending the video out after the recording. The answer is yes. Also, it asked for our slides, and I think we'll go ahead and post the slides as well. So we will go ahead and do both of those. Let's see here. Oh, here's a great question. Stacy, maybe as a program administrator, you'll be able to help with this. Is it possible to have a phone app for depositing checks into an ABLE account? So this goes back to the conversation that many of the ABLE programs are having about, app and using technologies to make it easy for people to use the accounts. Can you just give a little bit of a background on where maybe we're going with an app in the future, hopefully?
Yeah, so that's certainly on our radar for the future. It's not a thing currently, but we're always looking into technology and trying to utilize technology to the best of our abilities, and getting everyone on those platforms so we can make things easier for people to use.
And Stacy, you presented earlier on qualified disability expenses, which, by the way, we're probably going to be hosting a QDE conversation, maybe a webinar that's exclusively just talking about qualified disability expenses from ABLE account. It sounds like we're going to probably have to host that pretty soon. The question came in about, can you use ABLE funds toward a vacation to cover transportation and lodging? And if you've already made the purchase, could you reimburse yourself back again for the purchases? So maybe touch on, again, qualified disability expenses. And it's a great question that many of us get while we're traveling, doing outreach for ABLE accounts, is can we use the funds toward vacation, things like transportation, lodging, and whatnot?
Right. Yeah. And it all goes back to that quality of life, right? So it talks about being able to use these things that enhance people's quality of life, and a vacation certainly enhances my quality of life. I don't know about you guys, but so again, it's just tying it back to that quality of life, and the transportation, of course, is included in that. I've presented with an attorney before who likes to kind of like tie other pieces in as well, like maybe go to a museum and then you can tie in that education piece, so that you're kind of bolstering your argument, or whatever. So, but yes, absolutely, you can use it for a vacation.
Good. Thanks, Stacy. We know there's questions coming in. We're going to try to answer as many as possible. If we don't answer your question, please email us at info@abletoday.org, and we're going to help you as best we can to get you an answer. David, a question came in on cards and prepaid cards, for example. Are there maximum amounts of money that can be put on the cards, and how much could you carry? So if you could go that. The next one is, having money on the card, does that affect or go toward any of the $100,000 limits for SSI, which again, it kind of wraps up into the ABLE account $100,000 mark. So those are two separate questions, but kind of joined together.
Yeah, these are really good questions. And unfortunately, I'm going to have to answer saying it kind of depends on the ABLE savings plan for which you work, because some of us offer what's called a prepaid card, which might look like a debit card or a credit card, but actually you're kind of loading it with money. Others are offering a debit card that is inside the ABLE plan. The prepaid cards are often outside, almost like it's a separate bank account that's outside. And so the answer is just slightly different. So yes, there are going to be limits on how much you can actually load onto the card. Please check with your provider. Those limits are usually set by the card issuer or the provider. Sometimes they're set out of the safety of the individual, so that if somebody got a hold of this, they couldn't drain the full amount. Please check with them. It'll be in the information. It'll either be in the program disclosure booklet, what's this called? There's a document on these websites, or it'll be in the card member agreement, or you could just call the ABLE plan. So please check with them. When the money is moved from, I guess, I'm going to answer the $100,000 limit slightly separately, because this is an important one, is even inside the ABLE plan, that ABLE plan itself might allow you to save up to 400,000, even more in that ABLE savings plan, but you're referencing the one limit to supplemental security income, so the SSI benefit. You want to stay under that 100,000, even on the money in the ABLE plan. And like I said, when money comes out of the ABLE plan and onto a prepaid card, if that's how it comes, it's still protected as if it was inside the ABLE plan itself. So the answer is yes. You want to be careful of that $100,000 limit, regardless of whether the money is inside there or moved onto your prepaid card, just to make sure you're not getting to a place to where you would be over-resourced, and then the money's above them. That would then start impacting your benefits. I would just say, even if you're using the prepaid cards or the debit cards, please be cautious of the $100,000 limit.
Stacy, there's a number of questions that came in on how long to keep receipts for ABLE qualified disability expenses. Could you just talk about that? And then there's a second part to this, so I'll let you do this first part.
Sure. Yeah. So yeah, keeping the receipts is important for if you were reviewed by the IRS. Certainly the IRS is a tax entity, so I would probably, speak with your tax advisor for specifically how long you should save them. We don't really have a time frame of when you should get rid of them, so I would just, save them for as long as you can, I guess. And if your tax advisor had some different advice, I would follow that.
Then what kind of documentation or what kind of, again, things do rep payees and ALRs need to have as far as qualified disability expenses? There's receipts and whatnot, but what other kind of documentation or examples can we give for what do you need as you're spending money from your ABLE account?
Yeah, so certainly the receipts. Also, we kind of talked about paying like a credit card bill. So keeping that bill, because that's going to show, places where you were spending the money. So keeping those things. Any other sort of documentation you might have, bills or whatnot that you paid, or maybe like email communication if you're paying it electronically. Keeping those types of things would be good. Just so as long, like it goes back to that example of sitting in front of an IRS representative, right? Being able to say, this is what I spent this money on and this is how it ties to it. Having something to back that up that conversation would be what you'd want to keep.
Yeah, we have a great question from someone talking, and David, I think you might have mentioned this as well. Can you move money back from a prepaid card or a debit card back into the ABLE savings account? So if you put money on the card, choose not to use it, you want to put it back on back into the ABLE account, can you do that, and how does that work exactly?
Yeah, you can. So again, as mentioned, there are things, prepaid cards, and some ABLE plans will use a debit card that's inside of the ABLE account itself. The prepaid cards are outside, similar to like maybe a bank account. I already mentioned that. I'm only saying this because there's a way that I can answer for both of these. If the debit card is inside the ABLE plan, and you can always call your ABLE plan to ask if this is the case, money is moving from the debit card or from that one fund that the debit card is attached to a different one, it's going to kind of work differently. It's all still within the ABLE plan. My plan that we offer a prepaid card that's outside of the ABLE plan. If someone was to move money from their ABLE plan into the prepaid card, and then want to move the money back from the prepaid card back into the ABLE plan, we could work with you to do that. The thing though is that the money being moved back in would be counted against that $17,000 annual contribution limit. So you do want to make sure that you're trying to plan accordingly and not just moving money back and forth, because you don't want to eat up that $17,000 annual contribution limit there. That would be the only caution I would put there.
Thanks, David. For Stacy, there was a question about a contribution being put into someone's account. If they do get a 1099 or they do get a tax form, it's in the ABLE enrollee's name for having the ABLE account. But can someone still claim the money on their taxes that they made the contribution? So I think this question has to do with, how does somebody make a contribution into an ABLE account and claim it for a tax benefit? So maybe we could just touch on that for a little bit.
Yeah. And so obviously that's going to vary from state to state. Some states don't offer that tax incentive and some do. In Nebraska, we do. Here we require that you have the account number and the name, in your name and the amount that you put into the account. And then our Department of Revenue checks that. So I would definitely check with your state program to see what their rules and regulations are as far as being able to claim that tax benefit. It certainly is a really good benefit to be able to give to people's accounts and deduct that on your taxes. So
we have time for one, maybe two more questions. We want to make sure we make one clarification just real quick. Stacy, you had talked about the rollover from 529 into the ABLE account not counting toward the annual contribution limit. Believe the answer is it does count. So if you're rolling over the contribution from a 529 and you roll it into the ABLE account, it does in fact count toward the annual contribution limit, does it not?
I guess
David and I would both would
Yeah,
probably agree it does.
And there
Okay.
is, yeah, I mean, there's so much detail here, and I think
Okay, sorry, my bad.
no, not at all. I mean, again, I think this is important for everybody to see that with ABLE savings plans, there is so much detail, there is so much being added to this that we're all working to stay on top of this. Do know that your ABLE plan provider, the information that is listed on the websites and in the systems itself is correct, and we're keeping this up to date as we go. And that one does have a limit. So if you do have money in a 529 college savings that is more than 17,000 or even less, just know you're going to have to plan accordingly when you are rolling that over. You might need to do it in multiple steps because it is going to be tied to the annual contribution limit for that year.
Thanks. Lots of information shared today. Again, we've been going for an hour and 45 minutes with 600 attendees. We've tried to answer 700 questions. We are not going to answer every single question here now, but we're hoping to host more of these and keep giving information over. Stacy, I'm going to let you go first. Anything final you'd like to make sure everyone walks away with what's the most important thing about an ABLE account that they haven't heard from us 4 times yet today, or you can repeat yourself for the 5th time.
Well, so I think a couple takeaways. Read your program disclosure statement. Those are very important. Make sure you go and read that so you do get all the correct information because people like me are spouting off incorrect information. So I apologize.
No.
Make sure,
we clarified
yes,
your
you
statement.
clarified. Yes. So make sure that you are reading that so you are getting all the correct information. We are human beings and there's lots of details. So we want to. That's in writing, that's correct, that's checked over. So make sure you're reading those. And also make sure that you are spreading the word about ABLE, right? ABLE is a relatively new program. There are lots and lots of people. I meet people all the time that have never heard of it. So make sure that you are not keeping this awesome program to yourself and that you're spreading the word and letting other people know about it.
Thanks, Stacy. David, we have 20 seconds for you.
Okay, I really like that, Stacy. Thank you so much. Do know that we are working hard to make these as great a savings plan for you as possible. There's certain things we can do and certain things we can't do because there's just regulations on us. If you do have ideas to make these savings plans work better for you, please let your plan provider know, because oftentimes we just haven't thought about it and we can work to implement it. So do stay in touch with us. And thank you for this opportunity, Eric.
Thank you for joining us on behalf of all the ABLE programs, Brittany, Stacy, Eric, and David, from your respective states. On behalf of the National Association of State Treasurers, on behalf of all the ABLE Savings Plan Network members and ABLE Today, thank you again for joining us. If we did not answer your question, if you're looking to have a state-specific presentation on ABLE accounts for your community, please email us so we can be helpful, be a resource, and continue answering your questions. So thanks again for joining us. We'll get the recording out as fast as possible. Thank you.